Hi, guys. Welcome to another episode of Modern Health with Dr. Jane. I, of course, am Dr. Jane. I'm a naturopathic doctor and natural fertility expert. And I help couples who have been struggling with infertility for 1+ years to get to the root cause of their infertility struggles and conceive naturally. Today, I want to talk to you guys about digestion and fertility. What does digestion have to do with fertility? I see so many frustrations, and honestly, I don't know if it's my frustrations or your frustrations, but probably a little bit of both as I talk to you through Instagram and my DMs your digestive symptoms are just brushed off as normal. So I was diagnosed with IBS in my early 20s, and it's something that completely drove me nuts. And it is not something that I have anymore. So I want to just talk about the fact that your digestive issues are not permanent. Your gut can literally replenish itself. And once you get to the root cause and you can have a normal functioning gut, you do not have to worry about not pooping every day or being bloated after you eat something or having food sensitivities or having to run to the bathroom the moment you do eat something and splurge. Digestive symptoms are just not normal. And you have just not been told how it's connected to fertility. And that drives me nuts for women who are told they need IVF and they've gone through multiple rounds of IVF without looking at their digestion. And your digestion is a hot mess. You're inflamed all the time. You have skin issues like acne or actual like eczema and rashes, and you can't eat properly. You get bloated. And they're like, nope, not related to your fertility. We should just do IVF. Just think about that for a second. It literally makes me so mad just thinking about it, because why wouldn't it be? Why wouldn't your digestion be related to your hormone function and your fertility? It's literally the place that you put food in that then your body uses for nutrients to rebuild itself, including hormones. So yeah, it makes a big difference, you know? And I think another frustration is that you've probably tried some things, whether it's like a probiotic or a glutamine or some GI powder that you heard is going to miraculously heal your gut issues, but it maybe made things worse or made a small improvement, but it wasn't enough. And now you feel like you're just dependent on the supplement and you just don't want to be because, hey, guess what? It's not treating the root cause, and you're right there. So the mistakes that I don't want you guys to make is just to ignore your digestion. Please don't ignore it. It's really like literally the epicenter of your health. And so just because your doctor, your parents, like whoever said, oh, it's normal, or I have this too, does not make it normal, right? Common isn't normal. And the other mistake I see is you're trying to fix your hormones because you're so fixated on fertility, but you're not even looking at your digestive system. And I'll tell you is, I don't care if you have digestive symptoms or not. If your hormones are not functioning properly, you have digestive system issues. They just might be showing up in other ways. Like you're not getting bloated or have constipation or diarrhea, but you might have acne, or you might have some food sensitivities, or you might get a rash that shows up, or you might have some brain fog or fatigue. So digestive system issues do not have to only, in terms of symptoms, have to show up in digestion. And, you know, that kind of leads me to the third mistake that I see women make is there's like, you just don't do any testing. You're guessing in terms of what's going on with your digestion based on your symptoms, or you do very little testing, and then you're kind of stuck on this limited protocol. So you did some food sensitivity testing, you cut out the foods and it made a bit of a difference, but not enough. Or you're doing the FODMAP diet and now you have to be on the FODMAP diet for the rest of your life, or elimination diet or keto diet, whatever it is that made a small difference. Those diets are there and they're great, but they're only designed to be there for a short period of time. So you have to adhere to a strict diet, whether it's FODMAP, Candida, cleanse, whatever. Usually it's a sign that you did not deal with a root cause at all. And that's why you cannot introduce different things. Instead, here's what we want, you guys, and here's what we're going to briefly go through here is you want to understand the root cause. What is the root cause of your digestive issues? And I don't care if it's IBS, if it's ulcerative colitis, if it's Crohn's, if it's just mild constipation, if it's heartburn, you have to understand the root cause. If you don't get that, if you don't have those answers or your practitioner is not looking for that, you're always going to be stuck with your digestive issues, or you're going to be stuck on a strict regimen of supplements and diet that you can't step away from. And I was stuck in that as well when I was dealing with my IBS. And the last thing is you want to understand the root cause. And then you want to make sure you have that step-by-step plan so you understand what it's going to take to actually heal the gut. I think that there's a lot of issues in terms of, okay, I have candida, so I'm just going to treat that and that's that. When in reality, it's like, well, why is the candida there? Right? Do we have parasites? Do we have bacterial overgrowth? What do we have? Heavy metals? What do we have that's causing those issues? And then we want to build resiliency in the gut. You need to build resiliency so you aren't just stuck on limited things. Okay. Really, really important. So the gut, like I said, is the epicenter of your health. So we absolutely cannot ignore it. You cannot ignore it. And there is a really big connection between the gut microbiome and the reproductive microbiome. In terms of my patients, when they're struggling with infertility, one of the things I do is I run stool test analysis, and it shows us inflammation in the gut. It shows us how you're absorbing your nutrients, short chain fatty acids, which show us kind of the mucosal lining of the gut, the health of the mucosal lining. If all that stuff isn't working well, think about how close your uterus, your ovaries are to the gut. It's like it's all embedded. And we think this was a big aha moment for me, because when I did my cadaver lab in my naturopathic medical school in my second year, after we did, 2 years of intensive anatomy, and then we go in and do a cadaver lab in the summer after the second year, I was like, in the books, the digestive system is over here and the uterus and the ovaries are over here. So they're like totally separate systems. But in reality, as we cut out this person, it was like, oh, it's all crammed in there. It's all crammed in there. The liver, the gallbladder, the small intestines, the pancreas, literally the large intestine and the ovaries and the uterus. And they're all separated by like a single cell. So there is a lot of communication between the gut and the reproductive system, and what's going on in the gut versus what's going on in the reproductive system. And we're seeing so much research about that. Hey, turns out when the baby's born, they're not actually sterile at all. They actually have their own little microbiome. It's not very advanced or diverse, but they have their own little microbiome. And it's a reflection of what's going on for the female's body's microbiome. And then we can connect the microbiome to metabolic health, so diabetes and blood sugar regulation. We can also connect it to cardiovascular health and reproductive health and brain health, so autism, anxiety, depression. So there's like, hey, maybe there's something to it. So let's not ignore the gut, in terms of what's going on. And the gut is not just your small intestine and your colon. Like I mentioned, it's your pancreas, it's your gallbladder, it's your liver, it's, obviously the large intestine and the small intestine, but also your esophagus, also your oral cavity. So if you have a lot of stuff in the mouth, like root canals or infections or bleeding gums or cavities, like that's a sign of your microbiome imbalance going on. And I went to a biological dentist, and I haven't been to a dentist in a long time. It's something that I'm actually really bad at keeping consistent. And because I've been doing all this research on reproductive microbiome and oral health and just like general gut health, if you will, and how much it's connected, I was like, okay, I should go and get my checkup. And when I do my checkup in the cleaning, they're like, well, this is impressive that you haven't had your teeth cleaned for, however many years, but like, your microbiome is really good. Your gums are in really good health. And to me, it's like, well, obviously it should be. I take so much freaking care of my body that, don't get me wrong, there was some stuff that they recommended and I needed to get a crown and I need to get some work done. But that also then reflected in my data, my Oura Ring data, for example. My HRV started to go up and my heart rate decreased. So you never know what could be preventing or impacting your health, but the gut is all of those things. And I'm going to try to break it down in terms of what does the gut actually really do for us. It does a lot, but the main three things that I see and that I think are really connected to fertility of like what I see in my practice is, number one, it provides a barrier to pathogens. So every time you eat something, it has bacteria, virus, like there's trillions of viruses out there and trillions of bacteria. And so the mucus lining is a barrier to like bigger things, but then also think about like hydrochloric acid, the HCl that we produce in the stomach that will help to break down and kill off bacteria that is not supposed to be in the gut. And then obviously things will form into boluses and go into the small intestine. And that's when all the absorption will happen in terms of nutrients. But that big first component is it really provides a strong barrier to pathogens. That is what it's supposed to do. So if it doesn't do that, we're going to talk about why it's a problem. But the second thing is it helps to absorb and break down nutrients, right? Literally the foods that you're eating, you're going to chew it up and there is already enzymes. You already start to release enzymes in the mouth to help start breaking down the carbs and the proteins. So it's easier for the body to break it down. And then we have, actual absorption in the stomach versus in the small intestines and even in the large intestine, which vitamins get absorbed in digesting the foods. And then the third thing that the gut does is it gets rid of toxins, right? It gets rid of stuff that we don't need. So that's the old bacteria, any excess estrogen, any excess cholesterol. We get rid of a lot of heavy metals, environmental toxins. We get rid of a lot of stuff through the stool. It's the easiest way for the body to kind of dump that into the stool, if you will. So then we can get rid of that efficiently. And so when you're not pooping regularly, that's a huge red flag for me because yes, you need to be emptying out, but bacteria that we have internally, so even the good bacteria in our gut, it's not just static, right? The bacteria, think about fermentation. When you open up kombucha bottle or a beer or something that like a bubbly, right? It has that sound because the bacteria ferments. So kombucha is a really perfect example of that. Like that literally goes on in the gut. So that fermentation, if there's no movement, it just ferments. And what happens when it ferments inside? You feel bloated. You might get really gassy, right? And sometimes it's gassy like you're really burpy. And sometimes it's gassy like you have a lot of flatulence. So there's a lot of things that start to recirculate, like bacterial endotoxins. So toxins produced from the inside, estrogen, cholesterol, even the heavy metals, the environmental toxins, all that stuff just comes back into the bloodstream and starts to recirculate, and it adds a toll to our system. Like I said, there's a bunch of other things that the digestive system does, right? Intrinsic factor to help absorb with vitamin B12, vitamin K production happens in the large colon. Obviously, our microbiome is going to impact our mood and neurotransmitters and hormone production, so much more. But the main things that I see, and to kind of give you an overview, it provides a barrier to pathogen. It helps us absorb and break down nutrients, and then it helps us get rid of stuff we don't need. So what happens when it's not working well? So it actually just becomes a really big source of stress for the body. And it's kind of just starts to spiral downward. And the good news is once you start to spiral it upward, you start to notice really big improvement in all the areas. But the unfortunate thing is when it is really like when I had my IBS, and I don't think they had classified it back then when I had it, but it was a lot of urgency, a lot of loose stools, a lot of like, I didn't know what I could eat, when I was going to react. And it was really much tied to anxiety and stress for me. And then the unfortunate thing is like, well, then every time I ate, I would become stressed, especially if I was in public, because I didn't know how my system would react. So it was just not a good place, but essentially it became a really big source of stress in the body. And that's what happens when the digestion is not working well, because now not only are you not absorbing the nutrients, you're not getting rid of toxins efficiently. And by the way, like if you're having multiple bowel movements and they're just loose, it's not that like, oh, at least I'm good at getting rid of toxins. It's like, no, things are just going right through you. You're not actually grabbing stuff on the side. It needs to be a well-formed stool. You need to feel empty. There needs to be no irritation versus like, I'm just running to the bathroom. So that means at least I'm getting rid of stuff efficiently. It's like, no, you're not. There's lots of inflammation going on. So then we know essentially there's inflammation. There's the mucus lining is probably compromised. And that means that's how we develop food sensitivities. And so larger food particles are now getting through into the bloodstream. So instead of it being broken down into single molecules and then going in through the stomach lining, you have damage in the gut lining. And so the gut lining is kind of separating, spreading. And so larger food particles are getting in. And the immune system is like, well, what the hell is this? I don't recognize this. This is when people run food sensitivity tests and they're getting tested for avocado and cauliflower and like all the things that they're eating that are good for them. But guess what? It's your gut lining is compromised. And so things are just going into the bloodstream and it's, really impacting your immune system. And then not to mention pathogens right now, especially when we're stressed, that HCl production goes down. So not only are we not able to break down proteins as well as we should, or food in general, but protein is going to be the biggest one we're really going to struggle when we have low HCl, but it's also the pathogens. So now that HCl isn't there, we don't have that hydrochloric acid. The stomach is not very acidic. So now you can have more bacteria that's growing and overgrowing in even in the stomach. And then that can cause a lot of issues in terms of the closing of the different sphincters, like the sphincter between the esophagus and the stomach versus the sphincter between the stomach and the small intestine. Those are all regulated by pH. And so if the pH is all off, all of a sudden those sphincters are going to not be working well. And so we get into SIBO, small intestine bacterial overgrowth, or GERD, so heartburn, regurgitation, all that kind of stuff. And then not to mention now the HCl, we need it for intrinsic factor, which helps us with B12 production and B12 absorption, I should say. So now you're not absorbing B12. Now we're getting into anemia. Your immune system is really triggered because you're getting all these pathogens through, and all the food that's supposed to be nutrient dense is now actually being programmed as not good for you food, if you will. And so immune system is triggered. It can trigger a lot of autoimmune diseases if that runs in your family. So you just see how that starts to spiral. It just really starts to spiral. And then it's like, okay, well, how is that related to your fertility? Well, if you're depleted and your immune system is jacked up, and that's going to cause more depletion of nutrients like vitamin D and vitamin C and vitamins E and selenium and zinc, which are all the things you need for egg quality, sperm quality for the males as well, energy, hormone production. You don't have it. Your body's running on empty. You don't have it. And then you're not absorbing protein. And like, guess what LH and FSH are? They're peptide hormones. That means they're just groups of amino acids, and amino acids are just the single chains of proteins. So it spirals, you guys. Your digestion is really important. So how do we stop it? There are things that you can do on your own, and then there is time where you need to get help. So things you can do on your own, and then there's just time when you need to get help. The situation that I was in when I had my crazy IBS, when I first moved to Vancouver and I started my naturopathic school, I was in a place where I could not do the things on my own anymore. And that was really the big start of my journey with naturopathic medicine, because before that, it was kind of personal training and nutrition. And when I realized that that wasn't enough for me, then that's when I, got it. And it wasn't enough, not because those are not good therapies, but it was just like, I was already doing all that stuff and it just wasn't working. And it's not that I had to stop doing that stuff. I know that now, but I just needed to layer on another component. And, the naturopath that really helped me connect the dots, what was really causing my IBS, once I've kind of done all the physical stuff, it was mental and emotional for me. I had a lot of stress, a lot of loneliness, a lot of shame. And I had to really understand where those feelings were coming from and what it really, I just started to unravel myself, and that released a lot of anxiety. I stopped acting from a place of that shame and loneliness. And I just kind of got comfortable with feeling those emotions and being like, oh, okay, I'm just lonely because of X, Y, and Z. Or I feel shame when I do this, but that's actually programmed from my childhood. And that pattern is no longer serving me. So I would have to catch myself. And it was a lot of mental reprogramming, if you will, while learning how to support my body physically. So changing my exercise routine. I used to abuse myself in the gym, work out 5-6 days a week, feel really puffy and inflamed, thinking that I have to push harder, especially in the second half of the cycle, because that's when I would feel worse about myself. And I would just really run myself into the ground. So figuring out my exercise routine, then figuring out how to really nourish my system instead of just eating salads and under eating and then binging and, prioritizing sleep and hydration. And truthfully, those are all the things that I still do. I've just elevated every time the next chapter. What's the next chapter? What else I need to do? Because it's big. There's lots. I couldn't have done that on my own because I already maxed it out. So here are the 5 things that I need you to do on your own. Number 1, I need you to slow down. I just need you to slow down and take time to eat. I can't tell you how many people are always on the go and never sit down to eat. And then we wonder why we can't digest anything. Our digestive system works in parasympathetic state. That's rest and digest. versus fight or flight is our sympathetic state. So when we're in action, when we're in thought, when we're doing stuff. So I just need you to slow down and take your time to eat. Stop doing it on the go. It doesn't have to be every meal, but make it at least 2 meals a day where you just take a breath and you eat. The second thing that I need you to do is actually chew your food. I know it sounds insane, but when you're eating on the go all the time and you're just like 4 bites and swallow, your stomach has to work so much harder to digest that food. I need you to literally chew for a minimum of 20 times, but really it's like 30. And if you're eating something like steak, it goes up to as much as 50 to 70 bites, chews per bite. Just think about that for a second and think about how many chews per bite do you take? If it's under 10, you're not chewing your food enough. So just help your system out by chewing it. So then that protein and the carbohydrate, all of that can start to break down in the mouth. So by the time it gets to the stomach doesn't have to work as hard. Okay. So that's number 2. Number 3 is really make sure you're not eating when you are stressed. Now it kind of goes in the slow down, right? Take your time to eat. But what I mean by that is sometimes we force ourselves to eat because we're feeling really stressed or because you're like, I should eat. And the thing that you really need to do is assess your life and like, why are you always in fight or flight? Because if you're always in fight or flight, like your body's just going to break down, period. You can't even get pregnant when you're in fight or flight. Our nervous system creates from a place of abundance and vitality and peace, and it has to feel soothed and safe. And so it's like, you just can't feel safe when your body's literally running away from a lion. So whether it's, because sometimes I'll eat when I'm working, but I'll never work on something that is quote unquote stressful. Like I'll review a document while I'm eating versus check my emails or check my patient stuff. Because sometimes it'll trigger something for me and stressful. Because if some of my patients are going through something, I will feel it. And so it's like, I got to be mindful of when I deal with that stuff versus take the time to actually eat and slow down. The fourth thing is drink lemon and ginger water. This is probably one of the easiest ways to kickstart your digestion. You can do that 10 to 15 minutes before every meal, or you could do it just first thing in the morning before your breakfast. Make sure it's organic lemon, make sure it's organic ginger. Give yourself a good slice of lemon, give yourself a good couple slices of ginger. You can even grate the ginger and squeeze the juice out a little bit, let it sit. Those have really, both lemon and ginger, are really warming for the gut. They help with production of all the juices that we need to break down our nutrients, helps with bile production, gets that liver moving. Really easy way to start supporting your digestion. And then the last thing is go for a walk. So after you eat, go for a really calm 10-minute walk. And that will really help with blood sugar regulation, but it'll also just help with digestion. Now, I'm not talking about like pacing, huffing and puffing walk. I'm talking like, I'm just going to go and like look at the sun walk and look at the sky and see like what's up in nature today, as opposed to like, I need to get my steps in. You're still going to get your steps in, but it's not, you're not trying to break a sweat. This one, the walking one, I really like to implement after lunch because I have kids now. After dinner is not really realistic because the kids are on an early schedule, but we do go for a walk after lunch typically, or we go for a walk before dinner, but that's a different kind of intention. If you have the time, you eat dinner at 6:30, just put on wherever you are, put on some warm clothes or not warm clothes, depending on your location or when you're listening to this. Just get out for a walk. It's really, really nice. It doesn't have to be after every meal, but it's helpful to incorporate it at least once a day. If you've done all those things and then you're like, I'm doing all these things and it helped a little, but there's still some things missing. That's totally fine. It's not that these things didn't work. It's that those are as far as those things could take you. You're going to need deeper help. And usually that means you need to clean out the gut, and you need to support the liver, and you need to support the gallbladder, and you need to go on a special, detox for a certain period of time, and you need to use herbs to help pull out some parasites or bacteria. Like you'd be amazed at how much crap there is literally in our gut. So if you've done these 5 things and then you're like, that was good, but I still have stuff. Yeah, that's okay. That just means you need help. And I promise you, it's worth it to figure out your health, your gut, because it literally is related to every other aspect of your health and your fertility. And that will really help you when you figure your stuff out. It will really help you own that when you have your baby And my firstborn had a little bit of colic, but to be honest, like I had no idea what I was doing in the first pregnancy, even as a naturopath. My second baby did not have any issues with colic at all. She had some throwing up things, and that turned out her diaphragm was like pinching her stomach, and we got it released by an osteopath, and that was awesome. But you just can take control of the situation so much more and really help your babies instead of feel anxious. And I believe that we feel anxious because we have no connection with our body. We don't know what's going on. We don't trust it. And you have to learn how to develop, like it's a skill. You have to learn. And I know there is a deep voice inside of you that says, maybe I'm not supposed to live like this. And I'm here to tell you that you're right. You're not. And there's solutions and you can get them. And you just have to ask the right people, because we're out there and telling our story, sharing it with you and showing you how you guys can take control of your health journey, of your fertility journey, and really create that generational health. So if it sounds like something that you've been struggling with in fertility for at least a year and you have digestive issues and you're really looking for someone who's going to look at the whole picture, really help you figure out the root cause, run some lab work, and take you through step by step in terms of what to expect and even how to heal your gut and therefore your hormones and optimize your fertility, I encourage you to fill out my Maximize Your Fertility application form. And my team and myself, we will review it and get back to you and see if I'm the right person to help. Because like I said, you might just need some help now that you've done everything, or you might need to just try the things that I've mentioned in this podcast. So thank you guys for being here. If, like I said, if you would like to apply to work with me, just hit the link below and fill out the Maximize Your application form, and we'll get back to you. Otherwise, thanks for being here. Please share this episode with anyone who you think will find it helpful. I really appreciate it. It helps me get my message out and help women take control of their fertility journey. Thanks again, you guys, and I'll see you next week.